out there, Shelby? You look a little tired.
I'm a little tired, but I'll be alright. I can play.
You sure?
Yeah, I'm just a little dizzy, but it'll be alright. I'll be fine.
Alright, if it gets worse, let me know.
Alright.
Posterior position so I can monitor your heart, okay?
Okay.
Alright, stick your arm up in your eyes for me. Your eyes are dilated a little bit. Does the light hurt? Okay. So we have sensitivity to light. We're going to try to monitor your pulse. Hello, I'm Dr. Havens, and I will be taking care of you today.
Hello.
First things first, we need to get some medical history background for you. So, Miss Shelton, do you have a history of fainting or wheezing or collapsing at all?
When I was little, I was diagnosed with exercise-induced asthma.
Okay. We're going to run a few tests on you. We're going to run an EKG, an electrocardiogram, and we're going to run a CT scan, and we're going to do an overall physical evaluation with a chest x-ray and an MRI, just to completely rule out anything, since you haven't had a history of fainting or anything on the field before. So that's good. And now we're going to check for your heart. You sound like you might have a little bit of a heart murmur going on. Hello, Shelby.
Hello.
So I have some good news and I have some bad news. The bad news is that we misdiagnosed your childhood exercise-induced asthma when you were younger. So technically you don't have asthma. Good news is that we've actually caught what causes most sudden death in athletes, which is hypertrophic cardiomyopathy, and it is the excessive thickening of the heart muscle, most commonly at the septum between the ventricles below the aortic valve, that can lead to irregular heart rhythm called ventricular fibrillation. During ventricular fibrillation, there are numerous chaotic electrical charges to the chambers of the heart, and these result in no blood being pumped. You and your husband, as well as your sons, should also be tested for HCM because it is genetic.
Well, can I still play softball?
Unfortunately, no. After looking at your EKG results, the risk assessment is too high. We cannot continue allowing you to play sports.
So what's the protocol and procedures moving forwards?
Well, you continue to work out on your own if you feel like it, but your intensity level has to drop significantly. You can't compete anymore, but you can work out on a fitness level just to keep you in a healthy state. Anytime you work out, you should make sure that a defibrillator or an AED is on site just in case something were to happen to you. Now we're going to put you on a prescription that will help maintain a constant heartbeat to where you don't have any arrhythmias. And this medication is called propranolol.
Is it that for treating heart attacks?
Well, it can be, but it's taken orally once a day, and it's a beta blocker used to treat high blood pressure, irregular heartbeats, tremors, and other conditions such as after heart attacks. It is used after heart attacks to improve the chances of survival. So this will be good for your daughter. The drug works by blocking the action of certain natural chemicals in your body, such as epinephrine, that can affect the heart and blood vessels. This effect reduces heart rate, blood pressure, and certain strain on the heart in general.